We all know that there's a growing burden of cancer in the country. Every year, about 1.4 million cases get diagnosed in our country, and this number is likely to go up to 1.5 million cases by 2030. The lack of comprehensive cancer data means that we do not fully grasp the true scale of this disease. Unlike other diseases, cancer remains untracked at a national level, and this limits our ability to develop targeted interventions, standardized treatments, and allocate resources efficiently. Why should cancer be a notifiable disease? While you'll hear our distinguished speakers talk about it, but to give you a broad level idea, first advantage is that it will enhance the data accuracy and ensure that every case is recorded and overall a realistic picture of the cancer's impact across the country is provided. Second is that it is likely to improve treatment protocols with standardized guidelines that help in delivering consistent and equitable cancer care. And last but not the least, there will be a strengthening of research and policy decisions. Once a national cancer registry is made, it will also boost funding and enable more personalized treatment approaches. In 2022, it's important to note that the Parliamentary Standing Committee on Health and Family Welfare recommended that cancer be classified as a notifiable disease. Today, while some states in the country have done it, but many states still haven't notified or made cancer as a notifiable disease in this country, and hence we have gathered here to push for that notification across the country. So this initiative is not just about Apollo hospitals coming together for this collective call to action. It is about the entire healthcare ecosystem coming together for this noble cause.
Recently, in the budget which was passed on Feb 1st, there was a larger impetus and focus on cancer, adding a couple of life-saving drugs into those which can be in the category of customs-free, and then setting the mandate to start 200 cancer daycare centers, plus in the next 3 years an initiative to add at every district hospital cancer centers. But all this will not translate to having a paradigm shift in the way cancer is managed unless you first identify the disease, you understand the cause for it, and you also create, after notification, a registry and do something to reduce the burden of cancer, because you are frankly doing what is called as a fait accompli or a post event, where you actually set up something to keep treating people rather than taking steps to find out ways to reduce the burden of cancer, in some cases eradicate it, and in some cases to prevent it from vaccination. So one of the things we've taken up, well, there's another discussion we could have on the Made in India indigenous cervical vaccine program, and why shouldn't a larger universe of people who can be vaccinated get vaccinated when there are third world countries, as far as one in Rwanda, which has got a vaccine policy for cervical cancer covering their entire population, and developed countries like France and US, which has a cervical cancer policy. Notifying means that we get to know that India has a single policy when it comes to cancer, rather than leaving it to the interpretation and implementation to the state. Currently it's divided. Some states have a voluntary cancer notifiable status, some of them do not have it notified, and some of them are trying to take steps to get it notified. But if we wait for years together, the ICMR recommendation is a decade old, asking it to be notified. If we just keep waiting for it to happen, when you have the ICMR as a governing body from Bangalore, which has given a recommendation saying what are the benefits of getting cancer notified, and having worked on it, I think it's high time that policymakers and lawmakers in this country take it seriously, because it's the same body that they have constituted to actually understand what is the impact of cancer, what is the underlying reason, the burden of cancer, and such a recommendation being brushed aside, saying cancer is not a communicable disease, can't be considered as its own folly, because a lot of cancers are communicable. To start with, HIV-led cancers, hepatitis B-led cancers, hepatitis C-led cancers, HPV cancers, EBVs, just to name, and I'm sure my colleagues both the clinicians who are on this forum can further talk about the growing burden of these virus-led cancers, whether it's Burkitt's or whether it's cervical or head and neck or penile or whether it's lymphomas or each one of them. So there is cancers which are being also formed in society which are getting alarming increase in the incidence based on the type of communicable cancers that we get to see. That's one. So I'm just wondering what was the underlying reason that the recent pushback from the Health and Family Welfare Department of not getting it as a notifiable disease when the nodal agency which has been appointed for this as highly recommended to do. 2 years back in the Rajya Sabha, the bill has been in the standing committee, made a request to make it notifiable. We probably would remain among one of those countries which still today has not taken a national policy on cancer, having a national framework created for cancer, having a universal policy for cancer across the country.
I think there's no better day to make cancer notifiable disease than the World Cancer Day. And I think, thank you all for coming together. And I think we need to understand one thing, that we are in the middle of a cancer pandemic. There is no question about that. 14 lakh cancer diagnoses happen in India per year. Of the 14 lakh, the vast majority, about 8 lakh people die from cancer. This is one of the highest mortality rates we have compared to the Western world, where a significant portion of the cancers are cured. And the reasons why most of our patients die, we have anecdotal evidences that maybe because they're present late, maybe they're not aware of the diagnosis, or maybe the incidence of is quite high. But these are anecdotal evidences. We don't know for sure because we don't have accurate data. We have independent people trying to make cancer registries. We have some from Karnataka, some from other states, but we don't have a national database. As clinicians, what I know is that maybe gallbladder cancers are more common in North India, stomach cancers are more common in South India, but do we have a policy for that to identify what causes these cancers and at what stage they present? We don't. We know that the best way to reduce cancer burden is to prevent cancer from happening in the first place. So when we start talking about cancer, okay, causes of cancer, infection is one of the most important causes of cancer, and we fail to understand it. We talk about, of course, we talk about tobacco, we talk about alcohol, and they are important causes of cancer. But we fail to understand that infection is also an important cause of cancer. Hepatitis B and C causes liver cancer. At the same time, alcohol also causes liver cancer. Now, unless we have our own accurate database, we're never going to know that if there's an area which has high incidence of liver cancer, is it because of infection or is it because of alcohol? Do we need to increase the taxes on alcohol to reduce the cancer there, or do we need to vaccinate people so that there's reduction in the incidence of hepatitis B and C? So how do we then make a policy when we don't have data? Okay, it is impossible to do that. Okay. Similarly, when you look at HPV infection, which causes cervical cancer, okay, there is a vaccine that is out there. If utilized, the reduction in incidence of cervical cancer is more than 90%. But we have higher incidence of cervical cancer in the rural population. But it is the urban population women who are taking the vaccine. And there's a big mismatch there. How do we then identify people where the cervical cancer is more endemic and offer them vaccines? See, let us not forget that we live in a resource-constrained environment. It is easy to sit in rooms and talk that we should screen all women for breast cancer and all women for cervical cancer. But it's not going to happen. We don't have the money for it. Okay? So, but can we then screen out that maybe in urban areas, in these pockets, we need to do breast cancer screening, and in other areas where cervical cancer is more common, we need to do cervical cancer screening. That is a better utilization of our resources. But how do we identify that when we don't even know what the incidence is in any particular population? And that is why we need cancer to be a notifiable disease, so we can get that information. It is not just about the types of cancers, even the stages in cancers. We talk about that we have higher mortality in breast cancer compared to the Western world because our women present late. So most of our women present in stage 3 and 4. But then how do we know in which areas our women are presenting late and in which areas women are presenting early? Do we have the staging information? We currently don't have staging information. Certainly not population-based registries that tell us in which areas women are not coming up front. And maybe those are the places we need to focus, that maybe screening in those areas might be more useful. So both for prevention as well as for screening, it is very important that we have cancer as a notifiable disease. There are other causes of cancer that are kind of, a lot of that is overlooked. For example, asbestos or mesothelioma, which is a type of lung cancer. Now if we have pockets where where mesothelioma is more common, we can start looking at are the use of asbestos more common in that area, and then can we have policies to reduce the usage of asbestos to reduce the risk of mesothelioma. These policies can only be made if we have information. Lack of information does not help us to make any proper policies which are more cost effective for our population and patients. We also lack big time in research. Our cancer research, though, is catching up. A lot of the cancer research that happens is not designed for prevention and screening. It is more for treatment, it is more for biosimilars, generic kind of research, or laboratory research for very early drug development. But what about research for cancer prevention? What about research for cancer screening? For example, worldwide, we don't have a cancer screening for head and neck cancers. Because it is not the world's problem, it is our problem. So if you look at the incidence of cancer, worldwide, lung cancer and breast cancer is the most common. But in India, mouth cancer is the most common. And nobody does research in mouth cancer. Okay? And if we are able to identify pockets where mouth cancer is more common, so in places where tobacco is very commonly used, Northeast India, Kerala, Karnataka, where mouth cancers are very endemic, can we focus resources to ensure that we do research for mouth cancers in these areas, both to improve diagnosis, so have a screening process for our patients. For example, I'll give you an example. Stomach cancer does not have a screening protocol anywhere in the world, except Japan. Where stomach cancer is very common in Japan. So they have screening processes for their patient population. Similarly, we can look at having a screening process for our patient population for head and neck cancers, which is very endemic, but which parts in the country? If we don't have data, we will never be able to formulate policies. Similarly, can we then look at having research to improve treatment outcomes? Okay. Now, it is impossible to do a research everywhere across the country. We need to, for research, what do we need? We need patients and we need proper utilization of resources. If you can identify pockets of common cancers or rare cancers which are common in a particular place, we can start looking at doing some research, having our own data, and improving our patients' outcome and livelihood. So I urge all of you to please promote to ensure that cancer does become a notifiable disease, because like with everything, without data, we're never going to be able to proceed. Thank you very much.